Good morning. All right. I'm Tanisha Sullivan, Head of External Engagement and Health Equity Strategy here at Santa Fe. We are honored to collaborate once again with the Boston Globe for the second year in bringing forth this Health Equity Summit. This time here at Cambridge Crossing. Welcome, welcome, welcome. We hope that this may be your first time here. We hope that it is not your last time here in Cambridge Crossing. At Santa Fe, from Cambridge to Paris, to Cairo, to Rio de Janeiro, to Swiftwater, and Toronto, we take on tough challenges and we believe we can solve them. And in healthcare, there may be no tougher challenge, there may be no more urgent challenge than making certain that every person has access to the diagnosis, the treatment, and the care they not only need, but that they want. This truly is about people. We know that the research is crystal clear. Where a person is born, where a person lives, where a person works, can shape their health outcomes as much and sometimes even more than biology. We're talking about social drivers of health. These are not just data points to be reported. These are real challenges presenting real barriers faced by real people. Barriers to early diagnosis, barriers to the best treatment, barriers to long-term care. And here at Santa Fe, we believe that these are challenges we must tackle, not alone, but together. We see this as a shared responsibility. That's why we're working hard to make our clinical trials more inclusive. It's why we're focused on access across patient communities, and it's why we're partnering with communities, not parachuting in with answers, but listening, building long-term trust in support of what's working on the ground, most notably through our global signature initiative, A Million Conversations. For us, this is not charity. This is good science. It's good business, and most of all, it is the right thing to do. We know real progress doesn't come easily, but solving hard problems is what we do in partnership and collaboration with Sanofians, as we call ourselves, and our external partners. And that's what brings us together today for this summit. Leaders from across sectors, industry, government, academia, community, all of us not afraid to roll up our sleeves, all of us believing that we can get to better health outcomes, and all of us committed to moving forward with purpose. Because when we work together, when we stay focused, and when we lead with integrity, we don't just imagine what's possible, we make it happen. So I want to thank you all who are here assembled in this room, those of you who are joining us virtually. Thank you for what you are doing now. Thank you for joining us today. And most importantly, thank you for the work that you will do when you leave here, what you take from here to put into action. Thank you for allowing Santa Fe to be a part of this movement. And with that, I am super excited for this next discussion, of course, led by none other than the Boston Globe's very own, renowned, nationally recognized, phenomenal, nationally acclaimed, shall we say more? Fierce, 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 fierce. The one who created and produces a beautiful resistance, Jeneé Osterheldt. Thank you, Jeneé.
Okay, let me gather myself. That was thank you, gorgeous, brilliant you. Tanisha, know she gonna do it to you right quick. Thank you. I am I'm overwhelmed with joy to be here. I was already overwhelmed with joy to be with two bold, brilliant, and beautiful women here on stage. And when I walked into this room, my breath was taken away. And I don't want to take up too much time because they have wisdom to share. But my breath was taken away because so often when I'm on stages like this, I look out into the crowd, and the crowd's always beautiful, but the crowd often looks like a piece of my community. And this crowd looks like our collective community. So thank you, Sanofi, and thank you, Boston Globe Events, for ensuring we have such a beautiful collective space to share today. All right, we got Dr. Bisola Ojikutu, Commissioner of Public Health for the City of Boston, and the brilliant health strategist, Dr. Aletha Maybank, who has held many titles, but today we are recognizing who she is as a bold and daring health strategist. I'm going to start us off. Tanisha nodded to a beautiful resistance, and we're going to get into some heavy and deep things today because we're talking about health equity and the alleged reckoning and what it looks like to have real reform. So I want to ground us in some joy. I want to ground us in the why of the work each of you do, like why you were called to do it and what it is you do, and the joy in it. Because if we don't have a little bit of joy and hope in what we do, it'll eat us up alive. Either of you can start.
You're commissioner. This is your city. I am respecting that.
No, I appreciate that. First of all, thank you so much, Jeneé. Thank you, Aletha. I'm honored to be on this stage, honored to be having this whole session introduced by Tanisha, honored to be here with you all today. Maybe let me start by saying why, I do this work. I was born on the south side of Chicago. It's one of the most, okay, so I see a Chicagoan right there, south side, right? Okay. Okay. So one of the most racially segregated cities in the United States. And I grew up living and experiencing I say gross, it's probably grotesque inequity in education, in the built environment, in housing, in healthcare access. I watched my grandparents being sent home from local hospitals to die, essentially. And that's what happened. And they died prematurely. And then as I went through my career, going from St. Louis to Baltimore, New York City, I lived in Durban, South Africa for a while, now here in Boston, seeing the same thing over and over again, the ravages of structural racism, the ravages of systemic inequity, and knowing that that can't be our normal. It's neither normal nor is it inevitable. And I knew that my career had to be based in this if I could make some small change, whatever that may be. So that's why I do this work. And the joy, I gotta say, you said it, being here, the fact that we're still talking about in health inequity when we've been attempted to be silenced. You know what I mean? We didn't cancel this. We're still doing this work. We're still talking about it. And I think here in Boston and in the state, we're lucky because we have leaders who are bold, who are defiant, who inspire action and resistance, who haven't cowered. And I've seen that cowering across our country. And they haven't done things preemptively. You know what I mean? And I just appreciate that. I appreciate that steps are still being taken and we're moving forward to advance health equity. So that's why I'm here and that's my joy.
Awesome. Thank you. Well, thanks for the invitation. Thanks, Boston Globe, Tanisha at Sanofi. It was extremely warm, and I already mentioned this before, to see health equity, just the big, bold words across the sign, right? And so thank you for exactly what was just said, not silencing yourselves, therefore folks feeling they need to silence themselves, and to really make the statement that this is what we should be talking about. There's nothing, wild or crazy about saying we want optimal health for all. Really, that's what all we're saying. I say that a lot, and I've really been sitting a lot with that as I'm now kind of a free agent, I guess you could say. So what my why really came to me, as I've been doing this work, especially over the last couple of years. And it would come at the point when somebody would say, why are you taking it so personally? Why don't take it personal? And I would immediately say, this is personal. This is about me. This is about my family. It is about my community. It's about other people in my community. So the core of it is about love from my context. Like the root of why I do what I do is because of the love that I have for people and for myself, right? That's the larger context of how I've gotten to where I am. I've also grew up in spaces and places that were highly segregated. I was very isolated as a young child. And I'm sure a lot of that had a lot of influence in my understanding of how people show up in communities that don't look like me. I feel like I'm a strategist partly because of that. It helps because I've seen how people maneuver, but it's not my why. My why is rooted in love that we deserve all to have this opportunity to just live life with joy. And then the context of joy, when during COVID, I, had to find ways to do all kinds of things, right, to help ourselves. And so one of my friends is a music therapist, so I started music therapy. And I would go and, you get to sing a song and all. I'm not a singer, but, I can do my thing. And he would say, you come in here every time and you talk about freedom and justice, and you don't realize, but your ancestors were also fighting for your joy. I want you to go out and find it. And so that really that resonated me from that time, that the importance of the joy and why we're doing it also is because our ancestors were trying to create the same space for us. And it's almost, for me, kind of an obligation to keep that commitment up. And when we'd like to experience joy, right? It feels good. It's good for our health, actually. So that's the joy part of it for me.
Thank you. Dr. Ojikutu, I think a lot about, especially this year, I'm thinking a lot about Milwaukee and then how in 2019 they became the first city in the nation to declare racism a public health crisis. And a year later, Boston and many other cities followed suit. Can you tell us a little bit about the Live Long and Well agenda and how it addresses health inequities, how it's going, and where it's going next?
So I appreciate the fact that you're taking us back a few years in time to this point that we all should be remembering, even though I feel like we've let that go in a sense. Hundreds of cities declared racism a public health crisis. And I've been in spaces with leaders of those cities, and what I've found when you ask, did they do anything about it after they declared it? Or was that just a symbolic gesture? And in most cases, it was just symbolic. And that's what people are admitting to. They're saying that there wasn't funding to change things. There wasn't a plan. There wasn't an agenda. It was just something that was announced, and it optics in a sense. And what I would say that is different here in Boston, I have to say, is that money was actually allocated, taken from the police budget. You all remember the history, okay? The tragic murder of George Floyd, money was taken from the police budget by our former mayor and put into the public health department. So we had money to move things forward. Now, prior to me starting in this role, which was 2021, things were done, but what about the agenda? What about the plan? And that was actually where we came up with Live Long and Well. And that's our first population health equity agenda for the city of Boston. So that's what we're using to say, this is what we're doing. These are the key elements. This is how we're going to close gaps. The most, the most disgusting and disturbing of which is our life expectancy gap. I think most of you all have heard there's a 23-year life expectancy gap between one part of Boston that is primarily Black and brown and another part that is primarily white. That's not only that one part of Boston, there are actually other parts of Boston where life expectancy is also low. And this is a persistent and pervasive issue. The gaps have gone down, but they have not closed. So what we said in this Live Long and Well agenda is that in the next 10 years, we are going to close it. We're going to do things differently. Now, if you think about Boston, you probably think, well, this is a resource-rich city compared to other cities. We have resources. We have healthcare, lots of healthcare institutions, 22 community health centers, world-renowned academic centers. But what else is missing? What's missing is the collaboration. What's missing is the de-siloing of this work. What's missing is us actually collectively investing in problems, actually thinking, we're all going to work towards this. We're all going to row in the same direction. And similarly, I heard in the previous panel talking about lessons learned from COVID. When we row in the same direction, we do well. Okay, when we say to all of us collectively, no matter who we are, no matter what race, ethnicity we are, that we are going to achieve a goal, we get there. And that's what we're saying in Live Long and Well. We're all going to do this together. So this is, we're not even at 1 year yet. We have a $10 million investment by HRS Health Equity Foundation. We're putting this towards upstream factors because we know that inequity does not begin or end within the walls of healthcare institutions. It begins and ends in our communities. This is about structural issues. It's about systems issues. It's about what happens in our neighborhoods. That's where we're putting the money. These are community-led grants that we're going to be giving out. We'll be announcing them next month. So it's exciting, very exciting work. And I'm glad that this is a collective effort.
Thank you. Dr. Maybank, keeping with that same energy of 2020, can you touch on the work you've done, and then seen undone, and how this administration might undo it some more?
Yes, thank you. So I'm going to start what I've seen done, and it was well before I was at the American Medical Association. This has been the thread of my career. This has literally been my career of starting from the ground up, Centers for Health Equity and Offices of Minority Health. I've done 3 of them. I advised the CDC on their equity infrastructure. In the last administration, was a senior advisor to the director. So this has been my thing, since the early 2000s, I guess, soon after med school and residency. And so it was way back in 2009 that this really became a focus for me in a large city health department like New York City. So I was deputy commissioner at one point in time in the New York City Department of Health. Dr. Mary Bassett, who many of you, if you are in the health space, would be very familiar with her. And she was really one of the early people and individuals, leaders, health leaders in a city that said and stated and named racism as the fundamental cause of why these health equities exist. This was well before George Floyd. And so I was brought on to actually start a Center for Health Equity at that point in time. And, she was able to do, and it was a struggle then, but there was commitment to some level, a good level on the city, a part of New York City, to really have this focus on racial equity across all city agencies. So it provided this opportunity for us to learn of what it meant to, one, do it as our own, to build strategy within our own institution, how to organize our staff and teams to actually collectively move forward this work within the institution and evolve the structures and the policies and the culture, but then also collaborate at the larger city level with some other city agencies to support this work. And there was a larger network across the country that actually still exists, which is the Government Alliance for Racial Equity. And that's under this entity called Race Forward. And so there's been movement for a while, and even before that, right? This is all part of the civil rights movement. It really is. I mean, it's just this moment in time. And so in the last 6 years, so I was at New York City, launched that office, and then in 2019, ended up going to the American Medical Association, which put me more on the healthcare side of health in general. I was in public health most of my career, and anybody who's kind of crossed both sides, because that is what it is sides. They're different culture, different understandings, narratives around health are very different. And so when I got to the healthcare side, the narrative was even around what contributed to health was much smaller, right? It was really focused on what's in the health system, care system, as long as it's in the hospital or the doctor's office, payers, but not this larger, broader context of what we know contributes to health. And so what was starting to happen now was this awareness from the medical community that we have to pay attention to the social drivers, and I think the political drivers, and all these other drivers that we know impact the health that we have today, which was interesting because not everybody was on the same page of understanding. And so I was tasked to put this strategy forward for the American Medical Association. And what I learned is that if people don't have the same language, so I am full agreement, we need to have better opportunities to work together and collaborate together. But what I found, if people aren't talking the same language, they don't have the same understanding, our narratives are different. And our narratives influence our messages and our actions. And so the strategy was like an 80-page strategy. Who writes an 80-page strategic plan? Nobody, right? You shouldn't do that, right? However, what was clear is that there had to be some levels of primer that existed in order for everyone to be on the same page. And it ended up having pretty actually international influence. We didn't expect that. But it was a good thing on many levels. It received lots of attention, and the timing of George Floyd helped propel it. So I started in 2019. COVID came in 2020, December. So April 2019, COVID came December 2020. I'm sorry, 2019, 2020, the spring happens, then you have 2021. I'm sorry, I'm getting all my years wrong. 2020, the summer, right, is George Floyd. It was so helpful on many levels, so awful on many levels, and so helpful for many of us who were in that space to propel the movement forward within institutions. And we took it, and I'm a believer when you're in political environments, which are all environments, when those doors open, you push as fast and as far as you can in order to make as much progress as you can, because Lord knows they're going to close again, which we see happening, but not to we didn't think it would happen to this degree. And so now, to that point of your question, I say, I hear people, it's not shocking on one level, but it is on another level. You just didn't imagine that we would reach the point where, to me, the deep part of it is that people don't care. Like, that's the feeling of it. And that's kind of where I go now than the technical side of it, because what you're ultimately saying as you start to dismantle these structures that are caring for people, you don't care. You don't care as a system, you don't care as an individual, and you don't care as a leader. You're only focused on your self-interest. And that's what I felt I was getting paid for after a while in doing this work for so many years, was I was getting paid to figure out how to help people value things outside of their own self-interest. That's what the work is, right? It's about changing will. Data is important. You need data for accountability. You need data for consistency, a whole bunch of things. But data is not the point of which you get people to move and leaders to change their will to do better.
I want to, I have so many questions to get through, but I want to take a second because you talked about the work and like a lot of people who got into position or their work was propelled forward in the wake of George Floyd's murder. As Black women, I feel like we've always been doing the work before George Floyd, after George Floyd, and hundreds of years from now. And everyone always talks about, the first Black woman, or the Black woman who's doing equity work, or the Black woman who's paving the way and building the thing. But they don't talk about like how when you break that glass ceiling, you get cut. And they don't talk about the unpaid labor and disproportionate weight we carry, and how the labor we take into the community that benefits our employers that they take credit for is actually our own. Can each of you just kind of talk about that, what it is to carry that? Because it's part of the health equity conversation. It's part of our weathering. It's part of what affects our own mental health and actual physical health. And I guess I would say workspace health. Can you talk about that?
Well, maybe I'll start by saying that this is an important question. It's not just an important question for us as Black women. This is about how our world works and the dynamics that occur within institutions. As a Black woman who's leading a large organization, I have to say that there has been this overwhelming performance pressure. Feeling like I can't really make a mistake, can't say anything wrong. Everything I say, it better be right, or somebody's going to cross-check me. Right. And I've gotten many, many emails cross-checking things that I've said, no matter how innocuous, how irrelevant it may have been. And also this sense that we are supposed to fix intractable problems, problems that have been going on decades. Now here comes the magical Black woman who's going to ride in and fix it. And public health departments, I'll just speak about them for a second. They've been broken for a long time. We have a system where we don't, and we still don't, really build infrastructure in our public health system. How do we, actually get vaccines into people's hands, get them into people's arms? How do we check for lead? What about safe water? What about sanitation? These are all public health system things that we take for granted and we don't pay enough for. We don't build workforce. We don't train people. And this system is broken and yet, you know, you kind of just expect, oh, look, here's an intelligent sounding Black woman. Let's have her fix it. So let me just tell you a story really quickly. And somebody on the audience is going to remember this story. We were in the middle of the height of COVID, and we established a large vaccination, site. And it was interesting. It was oversubscribed. So we had too many people out there, too many people in line waiting for vaccines, and we had to turn people away. And for me, I felt, oh gosh, that's a failure. You know, here I'm a relatively new, had only been in for a couple years, and I was just waiting for the blowback. Okay. So within a week, I get a letter, chicken scratch, mail came to my office calling me an affirmative action DI hire. And no, seriously, I'll tell you, I looked at it, I read it, called my mother, read to her, called a couple of my friends. And it basically said that I would not be able to lead this response in the city. And I believe it's still in my drawer. I don't think I actually threw it away, even though you kind of want to throw some things and throw that or whatever. But when you think about it, I know for me, and would love to hear from you, when somebody tells you can't do something, when somebody tells me I can't do something, watch it happen. You know what I mean? And it took me a minute to recoup, to regather myself. And then I said, you know what? We're moving this forward, and we're going to do another vaccination event. And this is Melissa Hector. She was actually running that with me. So we know how that was a huge challenge, and we had to regroup and get ourselves back together and get back out there and do the work. And by April of that following year, we had closed the racial inequity in vaccinations. We had done that as a city. Awesome. And we did it because we didn't let somebody calling us a DI hire in some pejorative way, affirmative action hire, stand in the way. But that's hard on a daily basis. It's draining. It's burnout, and I'm not getting paid for all that. You know what I mean? I mean, just honestly, it's a lot that we have to go through, and a lot of the burden it feels that we have to carry that I don't see others carrying. I have to be quite honest. And talking to I don't feel that they have that kind of performance pressure. So it's something that we all need to look at, and we need to look within ourselves as Black female leaders and say, how much do we tolerate? I mean, quite honestly.
So, and toss it to me. Well, I first want to say, this is the first time we're in conversation together, and I know of you, of course. We have mutual friends. That's the other thing. As Black women, we kind of know the other Black women leaders because you need them as support in this way, in this space. But I'm really proud of you. I want to say that because we don't hear that enough from each other either. And that while, and I understand how people are viewing you and looking at you. And I also understand the internal pieces of it. And, I'm here today. So I no longer work within an institution. I can say I don't feel exhausted, which I'm very happy about. Right? I literally can say I don't feel exhausted, and also have a smile on my face. I don't know if okay. Can they hear? Okay.
Yeah, we're running out of time, but we're gonna take 2 more questions because we started 7 minutes late. So we'll wrap it. I want you to finish what you're saying, and then I'm gonna ask 2 quick questions, and we'll be out of here.
Okay. I just didn't know what the number was.
Take space.
Hey, okay. So, I've been doing this kind of work like for a very long time. And what started to happen over the last couple years, but especially the last year, and the last year of me before I decided it was time, it was a lot. It was a lot externally. The public murder of George Floyd, COVID was one level of experience, right? And to your point, because of all of the attention at that moment to equities, then it was definitely, so Aletha, what are you doing? I need you to do this. This needs to happen. And it might not have been explicitly expressed, but it was clear to me that I needed to perform during that time. And it's that distinction, performative versus what's authentic. Yes. And that tension becomes really stressful as well. And I think oftentimes we're put in that position to do both, honestly, because we know that in order for us to really have value as leaders, the people who are experiencing the greatest outcomes, they need to connect with us. We need to connect with them, which means we have to be our authentic selves at moments of time, at a lot of times, so that we can create that connection within the context of leadership. And that's exhausting too, because that leaves us very vulnerable to whatever comes our way, right? But we feel that obligation and we know it's really important. And then you have the folks who, are skeptical of everything you do and everything you say. And when I was first started at the institution, there were moments, and this is public, where there would be an audience, I'm speaking, and somebody's going to stand up. And I understand, because of AMA has a history, as a lot of historically white institutions have histories of racial injustice that are quite explicit and bad. And so there would be a person in the audience that's going to stand up and, you know, attack me and attack AMA. And I understood some level of it, but I have to carry that. And so after a while, that it's there's but so much one can take. And that concept that we know about weathering, it's one of, I definitely saw it around me in many different ways. We've read it. But then when you start to experience it, and you realize it's not even a slow violence, it can be real rapid. And when that started to happen, I said, oh, it's time, and I just didn't think I would get to that point, and then I realized, like, I'm going to have to stop and take care of myself, because nobody else is really going to do that, and I think these decisions are really hard, and especially in a moment of time like this. And the one last thing I'll say is just this context of real violence and physical violence. And you've had death threats, I'm sure. I've had death threats. I've had that security detail for 6 months while I was there. Somebody actually came to my home door and wrote "Die B" on the door. And I had to move because of a result of it and get a whole new place. So all of these things that we experience, that we oftentimes can't even don't communicate because we can't have that distraction.
I had to move and change my number.
Yeah.
And I think people don't realize Black women who lead in every sector carry that. Like, there's always someone who feels so threatened by your existence that they don't want you to exist at all.
That's right.
I'm gonna wrap this up. I know we're running late. My last two questions. You already know the last one, so I'll ask the second to last one first. With funds being ripped away and restrictive regulations putting research and jobs at risk, what is the future of health equity, and how do we empower people to still fight for it?
I'm being here on the stage, I'm having a fangirl moment with you because you've been doing this work for so incredibly long. And, we're linked on LinkedIn, but it's so good to finally make your acquaintance in person. I want you to start with this question, because think about this from a national level, and then I'll talk about it from a local perspective.
Well, I think, and you see how I talk now. I'm more, philosophical, kind of, in a way, I have come, like, I'm exhausted from being in, not now, but I think I've shifted my positionality of where I want to lead and do this work, right? And so I'm thinking about, what is my new identity, at this point in time. I don't want to ever work for an institution. I'll do advising and consulting and fractional roles, but I don't want to work full time for any institution. And I'm more interested in building and designing. So I launched a film studio and it's all about narrative. Like, how do we expand these narratives around health and elevate the stories that need to be told? And I want to do it in the frame of health, because oftentimes, what doctor show do you know that's not in the context of an ER, period? Like, all shows around health are like in the ER, and I'm like, health is so much broader than that. We could have a show on doulas. Like, there is so much in terms of films, and that's right, yes. And so my point is that there's an opportunity in that. So when I think about the future of health, I'm thinking it from a different position about what is the power that we have that we're going to own as communities that have been historically marginalized, because we have it. And how do we become collective in it? We're already resilient, like all those public health words of resiliency, and we're going to build it for people. We already have that. So what are we going to do to own it and build collectively? So the with us, by us, for us is really powerful for me right now. And on the previous panel, there was conversations about the importance of education. And then there was a conversation, I think Thea said it, about money and wealth. And so wealth, we know, and our friend, Dr. Michelle Morse, who's commissioner in New York City, did one of the reports from the health department on the impacts of health as it relates to your wealth, the assets that you have. So if we aren't in positions to do that, so I have a lot of interest in that space, and I think that those are the future of health. And then the last thing I'll say, clearly I don't, I have a lot to talk about, but say, is that I also think we need to frame, again, a narrative in how we collect data. I don't feel it's very motivating to hear Black women are 4 times and 5 times more likely to die. It also is not the way you build. The Black Progress Index that's done by Andre Perry at Brookings looks at the cities in which Blacks are living the longest and what's happening there. And that's a different, and you get away from the zero sum notion as well when you frame data in that way. So it's even for Boston, it's something that can be done. Where are Blacks or whatever the communities are, where are they living the longest and what is happening there? So you can build from that context and not all the deficits that exist.
No, I love that. I think that's really, yeah. I think, you know, data really needs to be seen from an empowering standpoint, and how does it build action, you know, and sometimes we get into the negative. What I'll say that I think is important here as we talk, and I listened to the previous panel, this idea of collectivism, you know, how do we work together? You know, Black people, we've been under threat for a long time. And I think this moment might be a moment where other folks are also feeling that sense of threat, that sense of anxiety too. And I'm hoping that that builds a sense of collectivism, you know, almost like we said during COVID-19, in the sense that we have a common enemy, common foe. If we see it in that way, maybe we can work better together to address these issues. And maybe we can bring in some partners who are more non-traditional and who haven't necessarily been at the table. And part of that is part of Live Long and Well, this idea of, okay, are we just gonna capitulate, or are we gonna do something differently? And I think that's what we need to do, is get together and figure out what is it that we need to do that is different from what we have done before. And that's how health equity will continue to be a goal. If we don't do something differently, then no, there's, you know, it's done. You know, we need to figure out what we need to be doing differently and what we could be doing better together. Less of the self-interest, like you mentioned, more of the interest of the collective.
My apologies to Erica and the team. I know it's time to wrap up. My last question, but the wisdom. I'm sorry, I had to soak it in. My apologies, but it's so much wisdom. I want to end it with how I always end it, which is to not frame it in the deficit. That's what a beautiful resistance was built for. So what makes your lives a beautiful resistance? And then we will let everybody go to their next very intellectual and health equitable conversation.
I would say, I think just it's following that gut, you know, and not being afraid of that, like literally the context of fear, right? So Nina Simone's always there, and the song there, and she always says, what is freedom? No fear. And so I'm not saying I don't have fear, because I do. But when it comes, that gut feeling says I don't need to be here, and I need to move on, or I didn't practice medicine except for 2 years. Even doing that and knowing I wanted to do policy, you know, when everybody else said, well, you don't do that as a doctor. My mom said that at Easter, you know, in front of everybody. So I think this, yeah, she did. She's okay now, you know. But just that's my beautiful resistance, is just following where I know I need to be and where I don't want to be.
I love that. I will just add very briefly that for me, my resistance that I think is beautiful is that I'm my authentic self. You know,
right,
people know
yes.
who I am. They know what I'm going to say. Those of you who've heard me before, you probably knew the script. You know what I bring to the office and what I bring to my life. You know, I'm not going to change that, irrespective of what the policies are saying, what the threat is, what the fear is, what the anxiety is. I'm still going to be my authentic self. And I think a lot of us in fear, we're doing that anticipatory acquiescence stuff, you know, or anticipatory obedience, scrubbing websites. Like within 20 days of that first executive order, I was given a talk and somebody wanted to look at it and take that out, DEI. Oh my gosh, you're going to say that? It's like, yes, I'm going to say that.
Right.
I am not going to be silenced, period. Don't worry. So that's my beautiful resistance.
Thank you.
Thank you, everyone, for joining us. We have some folks standing in the back, so if everyone could just move in a little bit and make some space, that would be greatly appreciated.